My name is Sheila Healy, and I am a member of Citizen Action of New York and HCAN, Healthcare for America Now. Citizen Action of New York is a not-for-profit grassroots organization formed back in 1983. We work at the grassroots levels in communities, do coalitions to fight for quality, affordable health care for all, quality public education, full public funding of campaigns, a fair federal budget, and an end to the war in Iraq. Healthcare for America Now is the broadest coalition in the nation working for affordable, universal health care for all. And I'd like to thank all of the people here today for joining us here this morning. American voters were clear in the last election that health care is a top priority for them, and they want the new president and Congress to tackle this issue in 2009. As President Obama recognized the value of the health care issue to the electorate. He signed on to the HCAN campaign just 1 month before Election Day. He did so to send a clear signal that he was going to champion health care legislation in 2009. We have two more champions of health care reform with us today. Congressman Paul Tonko, who represents the 21st Congressional District, and Democratic candidate for the 20th Congressional District, Scott Murphy.
The statewide Senior Action Council believes in universal health care for all New Yorkers, and everyone should have access, including the disabled, the seniors, and working poor. On behalf of our membership and across the state, I would commend Congressman Tonko and Scott Murphy for signing on the HCAN Statement of Principles, which support the guarantee of quality, affordable health care for all. Thank you.
I have a personal story. 2.5 years ago, my son went from speaking 10 words to none. He went from hugging strangers to hitting his head against the wall. And I work at a union, I work at a great company that has health care benefits, and I thought, oh, I'll be okay, I'll go to the doctor. I went to the doctor, and they informed me there was nothing they could do. I had to go to a developmental pediatrician, and my insurance wouldn't pay for it. So at that point, I didn't know what to do. I'm thinking I have the best health care insurance in the world. You know, I have a great union. Where do I go from here? I called my union, and they told me to contact the early intervention program by the state, and went to them, got in to see Dr. Malone, the best developmental ped in the area, and the next day they started treatment for autism. Now, it's $75,000 to $100,000 a year that my insurance will not cover, that the state covers. So my story is really anybody that thinks that state government or federal government cannot administer and run a public health care plan is wrong. Because they never asked me how much money do I make or what my insurance plan is. Their only concern was, how do we help your son? How do we help your family get better? And that should be our only concern with health care.
Good morning. Welcome to Arbor Hill, welcome to the Whitney Young Health Center, and welcome to my ward, which I represent. Corey Ellis and I from the 3rd Ward and I represent Arbor Hill, which is one of the most economically challenged communities in the city of Albany. It's a community where when a minor or curable health issue arises, people do not get treatment because they do not have the coverage that they deserve. We need to understand in our country, as our President Obama does, and as we are pushing Congress to understand, that health care is not a privilege, it's a right. Everybody deserves a standard level of care universally. And health care for Americans now will do that.